What if inflammation in your gut could actually travel to your brain and cause depression? Hi, I'm Jordan Reasoner, and if you struggle with depression and anxiety in your life, you're going to want to join me for this interview with Dr. Emily Deans, where we go deep into the inflammatory cytokine model of depression. Let's listen in.
Yeah, and there are systemic effects to these medicines, and I saw a couple studies in the last couple of years. One of them was a study of U.S. adults. 11% of U.S. adults are on antidepressants, and 20% are on some sort of psychotropic medication, and that would include those sleeping medications and sometimes temporary sleeping medications. And that's a huge amount of people. And we don't fully understand what these medicines do. Certainly, again, I prescribe some of these medicines. Some of those 11% are, some of my patients. And then there are cases where, I think they're extremely helpful. But, they're not as effective as we would like. They're not a magic pill to make people, not be depressed anymore. And they're really a very blunt instrument compared to modulating our immune system and modulating our pathology via diet, changes in the microbiota, sleep changes. All of those are they're also very powerful, but they're also more in line with our very complicated pathophysiology than just throwing, one pill in there that kind of does things that we don't fully understand, but some people feel better if you take that pill.
I've been fascinated recently to read more about the inflammatory cytokine model of depression and get familiar with the idea that these inflammatory cytokines that we talked about earlier could be possibly crossing the blood-brain barrier, suppressing activity in the frontal cortex, and having leading to depression. So can you talk more about that?
Yeah, it's the immune system near the gut will release, it will release IL-1, IL-6. Those are interleukin-1, interleukin-6. Those are types of inflammatory cytokines associated with depression. They'll send a direct signal to the hypothalamus that will tell your pituitary gland to tell your adrenal gland to release, to release more cortisol, and then there's back and forth reaction. So that is the exact interaction. How if your microbiome is off in your gut and it's causing an inflammatory reaction, that's exactly how it can possibly lead to depression directly as sort of an additional stressor.
You lay down. Thank you for clearing that up for me. That was really fascinating.
Did that clear it up?
Yeah, it was great. I love that earlier you talked a lot about some of the diet and lifestyle modifications that can improve gut-brain function. And I want to ask you specifically, because we've kind of danced around a little bit here, how important do you think it is for people to address the gut during the treatment of things like anxiety and depression?
That's a good question. And it's not, modern medicine tends to sort of divide people into systems. So an endocrinologist is thinking about glands, and a psychiatrist is thinking about your head, and a hand surgeon is thinking about the hand. But that's not really how I look at people, and maybe that's why I have to write this blog. I tend to think of people as this entire system. And so, even if I see a person, unfortunately, some of these changes are really good for everybody. So just switching from a diet of highly processed food to a diet of less processed food is going to help the gut, and it's going to be helpful for everybody. Managing sleep, making sure that you're kind of paying attention to your circadian rhythms, not up all night, not sleeping through the sun coming up and shining in the early morning, which that's one of the ways to make yourself depressed pretty fast, is sleeping until 10 or 11 every day. So all of those things can affect the gut bacteria, can affect the stress response, and all of those things can help a person, whether they have any gut symptoms or not. So I might ask everybody about their gut symptoms, but if someone's really basically doing okay, I might stress all these other lifestyle changes more But if someone comes in complaining of, gassiness, IBS, especially if someone's on different medications for GERD, gastroesophageal reflux disease and other things like that, then it's even more important. And in those cases, I might be even more aggressive and talk about probiotics, really talk about alcohol avoidance, if you can, avoiding those NSAIDs for a little while. Or if someone has chronic infections and they have to be on antibiotics, we talk about how that might be affecting their gut, might be affecting their brain.
I was so happy earlier, too, when you brought up blue blockers and just this idea of sleeping till 11 in the morning can make us more depressed, and how a lot of people will turn to alcohol, and in many cases that can kind of fuel the depression as well. Let's talk a little bit more about sleep. And interestingly, I just saw a study that camping for like 7 days could totally shift someone's circadian rhythm back to normal and just living more closely to natural light. So how much of a role do you think that plays in anxiety and depression, and kind of what recommendations do you have for people that you work with?
It actually plays a huge role. There's even back before we had medications, the very first thing you would do when someone was depressed is, if you've ever read old Victorian novels, what did people do when they were feeling down? They went to the seashore, right? They got relaxed. They stayed out in the sunshine. They would eat fish, get some of those omega-3s. That's how they would recover from TB and depression and anxiety. And back in the day, also they would take people to these massive, very large mental institutions that were mostly in the countryside, had a lot of farming, and they would make everybody go out and get some sunshine in the morning, unless they were manic, and then they would lock them in a dark room, which can also quickly decrease manic symptoms, which is when sort of the opposite of depression, where you can't sleep and you're filled with these great ideas, but you might actually become psychotic and think that you are a prophet or things like that, which does happen in bipolar disorder and schizophrenia. So we've known this for a long time, and you can actually take somebody with a depression, and if you just sleep deprive them for half the night, their depression will get immediately better. Now, the problem with that is that the minute you actually get a normal amount of sleep, the depression gets worse again. So you cannot sleep deprive someone forever, because then we try that. We're all sleep deprived in our modern lives. I just saw Dan Party's talk at PaleoFX, and he says we have 20 hours of sleep less a week than we did even 50 or 60 years ago. That's it's a huge amount of sleep that we're missing out on. And so chronically sleep depriving is a huge stressor and causes depression, but very acute sleep deprivation can actually cure a clinical depression temporarily. And these are called chronotherapeutics. And how you can actually use this, at least up here in the north, and you're in Montana, so you probably experienced this, you can get a light box, a 10,000 lux light, and during the months between September and March, if you give yourself that early morning light exposure, it's just as effective as any antidepressant medication for treating depression. And, it doesn't have a whole lot of side effects, except that, like any antidepressant, it can make some people with bipolar disorder actually manic, so you have to be a little careful. And I wouldn't do it after maybe 10 a.m., especially if you have any family history of bipolar disorder. But they're quite effective. And it's a way of giving yourself that morning light exposure even in the winter. And for, once it starts to roll around March, April, when you can get out, I'm always talking to my patients about not sleeping through the sunrise and really, getting up when you wake up at 6:30 or 6 a.m. or 7, and then also going outside and getting some morning sun exposure. And it's extremely helpful for depression. And then at night, again, avoiding all that computer use, avoiding being on your phone all night tweeting how much you're having trouble with insomnia, and trying to wear those blue blockers after, or installing Flux on your computer for use after sunset. And for me personally, that was something I didn't want to stop reading my Kindle at night. I have way too many books already, but unfortunately, so far I haven't found a great app for the iPad or for my phone that takes the blue light out of the phone. And just taking that blue light out stops that signal going directly to your hypothalamus. It says, good morning, good morning, good morning, right at, 10 p.m. when you're trying to go to bed, or at 3 a.m. when you wake up in the middle of the night and you want to see if somebody texted you while you were asleep or whatever it is. So just putting on those blue blockers before you turn on your phone and using them to read at night can be really, really helpful and help reset those circadian rhythms.